Hi everyone, this is Ate Perales from BSN 2A, a second-year nursing student of Northern Negros State College of Science and Technology. And today's video, we're going to do perineal care or perineal flushing. So, perineal care, it is the aseptic cleansing of the vulva and perineum, a cleansing of the external genitalia, perineum, and surrounding area. It is also referred to as pericare or perineal genital care. And this preparation is done prior to delivery or immediately before delivery. And the purpose or objectives of this perineal care is that to keep the vulva and perineum clean, to promote healing of the perineal wound, to provide comfort, to prevent infection, to prevent disagreeable odor. But before we do the procedure, we need to prepare all necessary equipment such as the flushing pitcher with warm sterile water, the forceps and the extra forceps, the breaking or the picking forceps, a pack of dry cotton balls, and also another pack of cotton balls soaked into antiseptic solution. And assuming this is our antiseptic solution, the tissue paper, and the perineal pad, the clean gloves, the bath towel, and of course a rubber protector, our kidney basin, and a basin, assuming this is our bedpan, and of course our waste receptacle. So since we all set, now we have to perform the proper hand washing to prevent the spread of microorganisms. Now we're done in performing hand washing. So prior to performing the procedure, we need to introduce ourselves and verify the client's identity using agency protocol. We need to explain the procedure to the patient and why it is necessary for us to let the patient understand the procedure and can improve the patient's cooperation. Good day, ma'am. My name is Ate Perales. You can also call me Ethel, a second-year nursing student of Northern Negros State College of Science and Technology, your student nurse for today. So before we start, can I see your wristband, ma'am?
Sure.
So please can you tell me your full name, ma'am?
Nicole Cruz.
Okay, how about your birthday, ma'am?
Jan 1 1996.
So what would you like me to call you?
Just Nicole.
Okay, ma'am Nicole, how's your day going so far?
Good.
That would nice to hear, ma'am. And I hope that our day will end up a good one. So today, ma'am, we were going to have an assessment called perineal care or perineal flushing. So I just wanted you to know or to be informed that these assessments wherein your genital areas will be exposed. Would that be okay, ma'am?
Okay.
That will be great, ma'am. So upon exposure, of course, we will be cleaning your genital area from any vaginal discharge for us to prevent contamination or infection. Okay, so do you have any questions or concerns, ma'am?
None.
Okay, thank you for that. So after that, we need to screen the patient or lock the door of the patient's room. This is important to provide the patient's privacy. So I am locking the door, ma'am. So after screening the patient, we will be wearing our gloves for infection control procedure. So if the patient has perineal pad, remove it or wrap it with paper and discard it to the waste receptacle. So loosen the foot part of the top sheet and place the patient in the dorsal recommended position. This allows the patient to lift herself onto the bedpan. Mama, I'll ask you to flex your knees slightly so that it would be easy to lift yourself when I place the bedpan. Okay, and then I will be placing a rubber protector. So place the patient onto the bedpan. Unfold the top sheet towards the knees and then place the bath towel over the abdomen. Providing privacy avoids overexposure, then the bath towel protects the gown from soilage. After that, we need to inspect the perineum and note areas of inflammation, swelling, excessive discharge or secretion from the orifice and presence of odor. So upon inspection, I do not smell any presence of odor and there are no any abnormalities, which is good, and we can now proceed with the next step. And pour sterile water over the vulva. So rinse off urine, fecal and vaginal drainage using warm sterile water. Warm water helps in relaxation of nerve endings. So now, we clean the vulva and perineum using a cotton ball soaked into solution. Use downward stroke in the following sequence. So as you can see, this is our cotton ball soaked into solution, and we're going to use pick-up forceps to maintain sterility. So first, we're going to start from the center of the vulva. Here, as you can see, and then discard it into the waste receptacle, and further labia minora, and of course do it on the opposite side, and further labia majora, and same with the opposite side, and our center of the vulva down to the anus, And then our mons veneris, mons pubis. Use one direction from side to side, starting from the lower portion, going to the suprapubic area. Here, discard. Contamination from the rectal area is prevented by using a downward stroke, cleansing an area where there are a few organisms before cleansing one with numerous organisms, minimize the spread of organisms in the cleaner areas. After we discard, use perineal bowls into the waste receptacle to prevent microorganisms. Rinse the area with warm water. See to it that the soap solution is completely rinsed off so that the skin and the mucous membrane may not cause irritation. So, as I've said, rinse area with warm water. Next, we have to dry the vulva and perineum with dry perineal bowls following the same sequence in cleansing. So this is our dry perineal bowls and another forceps to maintain sterility. So first, center of the vulva, discard it into the waste receptacle, farther labia minora, and on the opposite side, then farther labia majora, same with the opposite side, here, center of the vulva down to the anus, mons veneris, mons pubis, side to side, here, okay. This enhances patient's comfort. Wet or moist environment cultures bacterial growth. And then after that, we have to remove bedpan and turn the patient to side near you. Remove the bedpan. So after we remove the bedpan and turn the patient to the side near us, we have to dry the buttocks and anus using tissue paper. Here's our tissue paper. And discard it into the waste receptacle. Tissue paper is a mechanical means to help in cleaning the anus. So after that, we assess the patient to assume in dorsal recumbent position, apply medication as ordered, and perineal pad if necessary. So, assuming that we already apply medication as ordered and of course our perineal pad. Sorry, prompt attention to detail of patient's comfort and confidence. Discharges from perineal area are absorbed by the perineal pad. So after that, remove the bed protector or arrange the beddings and make the person comfortable. So now we already removed the bed protector. And then we arrange the beddings and make the patient comfortable. An orderly environment is conducted to health and keeps unit clean and neat. So after that, after doing the procedure, we need to wash our hands to deter the spread of microorganisms. So now we are done in washing our hands, and as per the above, any complaints of irritation or discomfort and their location, and any inflammation or swelling observed, and presence of unusual odor, and of course other significant findings, especially on clients with indwelling catheter.